Hello, dear friends, I am with you, Sofya Dorinskaya. I am a psychiatrist and the director of the Sofya Dorinskaya Medical Information Center. Today I want to tell you and finally, as it were, clarify the issue, and I hope this is where we will finish. Such an interesting question about the connection between vitamin C and kidney stones. I am honestly so incredibly tired of constantly getting all these comments saying that if a person simply takes vitamin C, they will just be buried in painful kidney stones, much like the blocked entrance to a dark cave. It is really time for us to sort this out once and for all, and carefully unravel all the complex chains of misunderstanding that have existed for so long. To uncover and shed light on all the false information that exists on this topic, and to put this issue to rest once and for all. So as I already mentioned, there is data. Everyone knows, but I don't know, right? It's a general medical fact that vitamin C is not produced in the human body, and any excess is excreted unchanged in the urine. This is a completely normal, standard, and stable fact that has always been relied upon, and everything was fine. And even in Soviet times, how did they determine vitamin C deficiency? They would give a person a vitamin C load and then monitor the amount of time until it started being excreted, and then the percentage of vitamin C excreted in the urine compared to the amount given. From this, they would calculate the degree of scurvy, make forecasts, and so on. This was completely standard, normal, everyone knows this. And here I understand this flow of comments, but it's completely forgivable for people without a medical background. After all, someone might have heard something somewhere, misunderstood something, and that's fine. But the situation is heating up, and finally, one person sent me a link to an article by Andrei Beloveshkin, a candidate of medical sciences, with a kind of remark attached, saying, "How come you, being so smart, don't know this?" Anyway, I started reading the article. On the second page of this article, it says that scientists have determined that 40% of all oxalates, which are the very salts, which are the substances from which these kidney stones are subsequently developed over time. And the direct chemical precursor of oxalates themselves is oxalic acid. And so, here is exactly where the detailed discussion truly begins to unfold. Oxalic acid and oxalates. So, oxalic acid and oxalates. Alright, and these oxalates, those very salts. Scientists have found that 40% of all oxalates are the result of chemical processes occurring in the liver. Well, okay. And 20% are the result of ascorbic acid metabolism. I'm sitting here and I didn't understand anything at all. What kind of metabolism? Alright, at the end of the page, the person writes, candidate of medical sciences. Endogenous oxalate. Internal, this salt is formed in two ways. As a result of ascorbic acid metabolism, it's already 30%. Well, at this point, I just hit some kind of mental block and I try to look further. And then the candidate gives us this kind of diagram. Ascorbic acid. Endogenous production is 1 milligram per hour. I just experienced a culture shock here, because it makes me wonder, how can there be endogenous production when humans don't naturally produce vitamin C in the body? I think this is something completely new. I start digging further. I think, okay, what is this catabolism diagram? What is this scheme of converting ascorbic acid into oxalic acid, the very acid from which oxalates are then formed? I find the textbook Vitamin C, Chemistry and Biochemistry by the authors Michael Davis, John Austin, and David Partridge. This textbook was published in Russian in 1999. And on page 111 it says figure 5.2, catabolism of ascorbic acid. Yes, here it really is ascorbic acid. You can see it, right? I hope so. It is catabolized, meaning it breaks down into oxalic acid. Alright then. But on page 110 of this textbook, it says that figure 5.2 shows us the catabolism of ascorbic acid in animals. Here, figure 5.2 is not labeled, but on the previous page it is indicated that this is a diagram of the catabolism of ascorbic acid in animals, comrades. Within the human body, ascorbic acid is not actually catabolized, to be broken down into the chemical compound, known as oxalic acid. It is catabolized in animals. When we look at those specific animals, it is actually and indeed produced in the liver. But there are specifically 3 distinct types of animals to consider. Well, living beings in which it is not produced. These are humans, monkeys, and guinea pigs. In all others, dogs, pigs, elephants, giraffes. I don't know. This diagram and this data doctor are for veterinarians, not for physicians. This is how the public was misled. So this is something was guessed. Sherrick guessed it. This is what we have. This is what medicine is turning into now. Okay. Next, I look to see where we have. Well, where do our people study? On the internet? Well, I think, okay. What else is written on the internet? I see an article which is called, Well, Just Die, Don't Get Up. Vitamin C damages men's kidneys. Good heavens, now it will be revealed to me. I'm reading. Scientists from the Karolinska Institute in Stockholm, in parentheses within the walls of this university, every December the announcement takes place, of the Nobel Prize laureates in physiology and medicine. Apparently, at this point, all readers are supposed to be stunned by the impressive researchers collected data on daily vitamin C intake and other dietary characteristics, attention, of 48,850 men aged 45 to 79. All right, that's a large-scale study. The men had to regularly fill out questionnaires over the course of 11 years. From the start of the study in 1997 until 2009, they included men aged 45 to 79. Had 11 years, and how many people didn't make it to the end of the study? That's my question, because if you add 11, that's 90 years old. Throughout this entire period, any kidney stones that developed were recorded. Among the collected data, risk factors were also taken into account. These included the development of urolithiasis, tea and coffee consumption, smoking, arterial hypertension, and diabetes mellitus. So they also included a risk group because arterial hypertension and diabetes mellitus are actually among the strongest risk groups for developing urolithiasis. All right, so let's remember this. They took 48,850 men. Next. When analyzing the results of the study, for 11 years they ate the taxpayers' bread. When carefully examining and analyzing the comprehensive findings and results of the scientific study published in Game International Medicine, it was clearly observed and determined that consuming 1,000 milligrams of ascorbic acid in various pharmaceutical forms daily leads to the rather rapid formation of kidney stones. Period. Scary. And then what? Among 680 men who took such high doses, each year 1 new stone appeared per person. They included 48,850 men in the study. These men were also in the risk group, meaning they had arterial hypertension and diabetes mellitus. At the same time, kidney stones formed in 680 people. In percentage terms, that's 1.4%. Normally, in the population of healthy people who do not suffer from, who are not in the risk group like those with arterial hypertension and diabetes mellitus but are relatively healthy, right? That is, of course, if they have stones, they're not really healthy anymore. So people who are not in this risk group in the general population, normally 1 to 3% of the population suffer from urinary stones, and here it's 1.4%. But if people are in the risk group, then it's due to diabetes mellitus and arterial hypertension. Their risk of urolithiasis increases by 6 times. So we have a control group, which included people suffering from arterial hypertension, diabetes mellitus, who smoked, drank coffee and tea. And it's not even clear what else they were doing. Their age was already close to 100 years. So by taking vitamin C, they developed urolithiasis in 1.4% of cases. But if they hadn't taken vitamin C, it would have been 18%. So in reality, how much is that? Vitamin C actually saved the lives of 16.6% of people. Well, there you have it. How can you possibly just manipulate and distort the information so much that the beneficial healing properties of vitamin C have somehow turned into some kind of dangerous and frightening threat? But let's not criticize the internet. There's more to it. So, a few years ago, it was scientifically proven by the Kidney Stone Research Laboratory at the University of Cape Town. In a controlled study, 10 healthy volunteers took 4 grams of vitamin C per day for 5 days. Urine was collected 24 hours before, during, and after taking the vitamin, but the type of vitamin was noted. The urine collection procedure was designed in such a way as to analyze oxalates, those very salts, yes, in the presence and absence of a preservative. It turned out that the excess amount of ascorbic acid is excreted from the body unchanged. Who would have thought? Turns out, thank goodness. And its metabolism into oxalic acid actually occurs in the test tube. A warm hello to everyone. Unlike earlier studies, a preservative was placed in the urine collection bottles. To prevent this transformation, previous studies did not take it into account. As a result, they mistakenly identified high levels of oxalic acid in urine. Our warm greetings. As you can see, gentlemen, therapy has always been considered the undisputed queen of the medical sciences. And now, unfortunately, it has simply been turned into some kind of wayward girl, used by anyone who feels like it. Everyone who can speak coherently already considers it possible to express their opinions about therapy, medicine, and treatment in general. And how cleverly, guys, how cleverly we were misled with the scheme of ascorbic acid conversion in the bodies of animals. And now our doctors are using this data. Guys, if we are treating people, it's not for those, well, we're not veterinarians. These are different organisms. Do you understand? Do you see how far this goes? Let me read you a comment. Hello, Sofya came 2 hours ago today. This spring, my husband had the flu. A young new district doctor came and said under no circumstances should he take vitamin C. At a high temperature, supposedly there will be acute kidney failure. Guys, if we start teaching doctors based on data meant for veterinarians, well, I don't know where we'll end up. You see, this is certainly no longer medicine. It's just some kind of witch's Sabbath. Alright, let's move on and deal with that very oxalic acid. In fact, oxalic acid is not just some kind of acid. It's a very beneficial compound that is very much needed in the human body. So, oxalic acid has a positive effect on the condition and functioning of the digestive organs and stimulates muscle activity. It normalizes the functioning of the nervous system. It has a beneficial effect on the functioning of the female genitourinary system. It helps prevent the development of amenorrhea, female infertility, relieves pain and heavy bleeding during menstruation, and eliminates unpleasant symptoms of menopause. It prevents the development of infertility and impotence in men. It possesses excellent bactericidal properties. They are recognized as indispensable aids in the fight against intestinal infections, tuberculosis, rhinitis, chlamydia, sinusitis, migraines, rheumatism, and other pathologies. This is truly a very necessary substance. How much is safe for a person to consume so that oxalic acid in the body remains within normal limits? All researchers agree on this, including this particular study, by a candidate of medical sciences who ultimately brought in zoological schemes for treating people. So everyone agrees that 50 milligrams per 100 grams is the standard. If we look at the tables showing the oxalic acid content in foods, it turns out that The highest amount of oxalic acid content is, for example, in dill per 100 grams. But you don't eat 100 grams of dill, right? If, for example, there are milligrams per 100 grams, right? A cracker has 207 milligrams per 100 grams. Well, okay, that's a cracker. Then there's lamb, just traces I don't even know. Plum, 10 milligrams per 100 grams. Strawberries, 15 milligrams per 100 grams. Well, look, liver, 7 milligrams per 100 grams. If a person eats, for example, an adult 1.5 kilograms of food. Basically, in order for a person to consume the permissible amount of oxalic acid per day, calculated based on liver, they would have to eat more than 10 kilograms of liver a day. Can you even imagine that? So this is the supposedly dangerous oxalic acid that leads to oxalates. You might ask me, please tell us, let's talk about the kidneys, about stones. Where do these kidney stones come from? Alright, let's recall that oxalates. These are salts that are excreted in the urine and they are normally present in urine. That's normal. Yes, there can be an increase in them or a decrease. You always need to look for the answer to the question why. But here, again, we've forgotten one interesting thing. Let's remember that there is a deficiency of one vitamin, which is called vitamin A. What are the signs of vitamin A deficiency? One of the most striking clinical signs, which used to be used to identify people with vitamin A deficiency, it is increased shedding of the epithelium. People would come in and there was even a symptom described as if the face were dusted with flour. I bet that nowadays such people simply don't exist, unless you're dealing with the most marginalized individuals who live in heating ducts. Because absolutely everyone watches TV and they know how to deal with dandruff and they know there are exfoliating products that remove flakes from the face. Therefore, cosmetic products for topical use and cosmetic manufacturers add vitamin A. Vitamin A is delivered topically and these symptoms are smoothed out. But increased epithelial shedding doesn't happen only on the skin. It happens in the kidneys, in the epithelium lining the inside of the kidneys. It happens in the gallbladder, in the epithelium lining the inside of the gallbladder. It happens in the urinary bladder, in the epithelium lining the inside of the bladder. So what do we get? When a person has a vitamin A deficiency, they experience increased shedding. This epithelial shedding occurs in the gallbladder, in the kidneys, and in the urinary bladder. And these flakes don't have time to be removed. They become saturated, this is called impregnated, with the salts that are normally excreted. And this is exactly what forms that sand, which then simply gets compressed into stones. And people with a vitamin A deficiency are statistically more likely to have kidney stones or gallstones, precisely because they have a vitamin A deficiency. And this sloughed off epithelium. Vitamin C has absolutely nothing to do with this situation. Absolutely nothing at all. Listen to me, my friends, you simply cannot throw real medicine in the trash. It is something that you just can't do no matter what. It is far too dangerous for everyone. Because otherwise we will end up being treated ourselves. According to treatment protocols for dogs. Something tells me that right now students in veterinary institutes are being taught much better, because nowadays some animals are very expensive. And if veterinarians mess up and, I don't know, $1 million horses start dying, then no one will want to go to such institutes. But with people it's allowed. What? But when it comes to actual people, it is somehow allowed. Human beings can be treated according to strict protocols meant for dogs, cows, I don't know, horses or whatever else. At the very end of this, I would really like to read some specific data to you. As I mentioned to you, here is a study from 1977. Here's another one. In addition, Hester's research in 1977 showed that people with high vitamin C intake up to 1.5 grams had a lower risk of developing kidney stones compared to those who consumed minimal amounts. In 1977, Hester reported this and confirmed it. Thank you, Mr. Hester. In fact, this study I told you about with men aged 45 to 79, this study absolutely confirms Hester's findings. As you can see, I showed you that there was actually a fantastic reduction in the percentage of kidney stone disease cases. Now, as we reach the conclusion of this ceremony, let me, with the greatest respect, the deepest sense of reverence, and most sincere gratitude to all of our wonderful teachers and mentors, I will now read you some excerpts from the very informative brochure by the esteemed Doctor of Medical Sciences Efremov. A brochure that was originally published back in the year 1942. The year 42. How many years ago was that? 30? That would be 72, right? 77, so 35 years ago. Yes, 35. Before these studies, humans, apes, and guinea pigs are unable to synthesize vitamin C in their bodies, whereas other animals synthesize it mainly in the liver. After 3 to 6 months on a diet lacking vitamin C, a person develops vitamin deficiency with scurvy. The highest number of scurvy cases usually occurs in the second half of winter and in early spring. A predisposing factor is a monotonous carbohydrate diet with insufficient overall caloric intake. In young children, scurvy presents in a somewhat distinctive form, the disease. Miller-Barlow disease. Impaired absorption of vitamin C is clearly present in cases of vomiting, diarrhea, changes in the mucous membrane of the gastrointestinal tract such as circulatory disorders, inflammatory and atrophic conditions, gastric ulcer, duodenal ulcer, and gastritis. It is also observed in cases of gastrointestinal secretory disorders and impaired bile secretion in cases of mechanical disorders of the gastrointestinal tract caused by surgical interventions. The destruction of vitamin C in the gastrointestinal tract can occur with impaired gastrointestinal secretion and then under the influence of bacteria, and when there are changes in the chemical reaction of the environment. The destruction of vitamin C also occurs when it binds with toxins in certain diseases, such as diphtheria, brucellosis, rheumatism, scarlet fever, lobar pneumonia, as well as in local and general purulent infections and sepsis. At present, a number of authors have proven that the nature of the intestinal flora can contribute to the breakdown of ascorbic acid, and thereby lead to the development of endogenous forms of hypovitaminosis and of vitaminosis C. In fact, vitamin C is so unstable in the human body, and there are so many factors that destroy it, that there is no system in the human body to catabolize it. There isn't one. It breaks down there far too quickly. That is precisely why doctors should always be alert to the possibility of scurvy. The body's need for vitamin C increases during the ovarian menstrual cycle. In women, this also occurs during pregnancy and breastfeeding, with intense physical exertion in the mining industry, when working in hot workshops, and in certain hazardous chemical industries, such as the production of benzene and some acids. It also occurs during oxygen deprivation, high-altitude flights, and altitude sickness. An increased need for vitamin C has been observed in a number of infectious diseases. In cases of lobar pneumonia, acute articular rheumatism, epidemic influenza, typhoid fever, dysentery, sepsis, angina, measles, whooping cough, scarlet fever, diphtheria, meningitis, and others. Tuberculosis should be especially noted, as a very significant deficiency of vitamin C is found in the body during this disease. A pronounced deficiency of vitamin C in the body has also been identified in cases of general and localized purulent infections. Finally, an increased need for vitamin C has been observed in certain endocrine diseases, hyperthyroidism, Addison's disease, metabolic disorders, and so on. Impaired absorption of vitamin C can occur with achilia, which is reduced stomach acidity, or the absence of acid in the stomach. As I mentioned in the video, antacids, yes, people take them because they have stomach pain. After stomach resection, and in severe diseases of the liver and pancreas, absorption is also impaired. This also applies to diseases of the hematopoietic system. Once a person has had C vitamin deficiency, it makes it easier for a new illness to develop. Such sensitization or sensitivity remains for several years, not just 2 or 3 days, but for many years, and requires the patient to pay close attention to even the slightest health disturbances, especially to disorders of the gastrointestinal tract, which affect the normal absorption of consumed vitamin C. And finally, I would like to present to you the classification of the course of vitamin C deficiency. Several are presented here, but here is a shorter version for someone. This is from the same monograph, the brochure by our teacher Efremov, Doctor of Medical Sciences, 1942, Russia. The first stage. There are no clinical manifestations of scurvy. There is a deficiency in tissue saturation, a sluggish response of the organism, and poor healing of wounds and fractures. The second stage. There is a deficiency in tissue saturation and a hemorrhagic syndrome. And the third stage, a state of vitamin C malabsorption gastrointestinal disorder, that is at the final stage of scurvy already. A person cannot be saved because they can no longer absorb vitamin C through the gastrointestinal tract. But also a prediction. Timely and properly treated vitamin C deficiency always gives a good result, a good prognosis, but on the condition that, what if, for several months, the recovered patient must follow preventive measures with a special diet, since the body remains sensitized for a long time. So, there is a risk of both a recurrence of vitamin C deficiency and various infectious diseases, most untreated cases end fatally. I hope, my very dear and loyal friends, with every fiber of my heart and all the depth of my soul, I truly and sincerely hope, my esteemed colleagues and my wonderful bright young colleagues, that we shall succeed together. First and foremost, it is absolutely essential that you will finally stop relying on the false information provided by charlatans, deceptive manipulators, and dishonest schemers in the field of medicine, who incorrectly present basic animal biochemistry as being identical to complex human biochemistry. That's the first thing. And the second, knowing that vitamin C is not produced in the human body, that it is extremely unstable yet absolutely essential for the body, in all these cases, you will stop telling your patients, those who are very seriously ill, those who are suffering from severe inflammatory diseases, and even the flu patients who are coming in for treatment right now, serious conditions. You won't be telling them such nonsense as if they take vitamin C, their kidneys will fail. Without vitamin C, you won't cure a single serious illness. And your patient will slowly but surely deteriorate, like a snowball rolling down a hill. These diseases will keep piling up, and in the end, he will die sooner. And to you, my dear viewers, I hope I have also answered the question about the connection between vitamin C and kidney stones. I really hope I won't be getting any more comments like that. This was Sofya Dorinskaya with you. All the best. Goodbye.